Okay, hello everyone out there. My name is Donnie. I'm in Central Jersey here. Just wanted to give you my update on the PRP. First update, I've been doing some on my phone, but now I'm going to take some footage here on the GoPro. Had the PRP on Monday, and today is Wednesday, October 17th, 2018. I'll give you a brief background about myself. I'm 34 years old. I've had knee problems since I was in my teens on the same knee. I used to play a lot of ice hockey. I was a goalie. At some point I think I tore my kneecap cartilage then, but I had a lot of sharp pain most of my life into my 20s. I played ice hockey at first. Then I got into paintball real heavy, and that's a lot of slide around, a lot of diving, things like that, so it didn't help with the knee. And all this time since I was 14, I've done construction. So a lot of heavy work, a lot of wear and tear. So eventually when I was in my mid-20s, the pain in my knee got too bad and was kind of locking up. So I went to see orthopedic, and he told me, let's go in there and see what's going on. I thought I had a torn meniscus. Well, he went in there, my meniscus was fine at the time, but he found a lot of torn cartilage in my kneecap. So I told him, do we need to take that out? Why? He says, we can take it out, but you might get arthritis. This was in 2013. Once again, it's 2018 right now. The last few years, I've had a lot of pain in the knee. It's kind of like a constant pain, and I'm a tile setter and carpenter. So, I'm up and down on my knees a lot of times of the day, and that doesn't help. I wear really good knee pads, but, wear and tear is going to catch up to you. I think from my point of view, from the surgery, did it help me removing the cartilage of my kneecap? I don't know. Because, like a year or two later, once all the swelling really went down from the surgery, I don't feel much different, really. Yeah, it functions for sure. It doesn't lock up, but it it hurts. So rewind a few years. About 2 years ago, I was on vacation. It was real dark out. I wasn't really watching what I was doing, and I stepped down, I twisted, heard a loud pop, and it was hard to walk for the next few days. Got back from vacation, went to see orthopedic, and they took an MRI, and they said they got a torn meniscus, small tear. But that was 2 years ago, and I've been to a few orthopedics, and they want to go in there and scope it out, remove the torn piece. And from my experience having the surgery on the kneecap, and taking your cushioning out of your knee is not something I would recommend. Yeah, you might have less pain and you might get arthritis, but really, if you take it out, you're gonna get arthritis either way. So I'd rather have a torn piece in there and just deal with the pain than removing it and have potentially bone on bone sooner. So I've been researching a lot last 6 months or so, and I'm pretty heavy on YouTube. We got my own channel here, Fisher channel as well. So I've been researching online last 6 months, and I found this PRP. It's called platelet-rich plasma. Essentially what they do is they draw your blood. Everyone draws a different amount. This is something that's not covered by the insurance. You pay out of pocket for it because it's only about 10 years old or so. There's mixed reviews about if it working or works, but a lot of people online are saying, I watch Joe Rogan's podcast a lot, and he had ACL tear, meniscus, real bad injury, worse than mine probably. And he had the injection done a year later, and he's telling me, he's saying that he has no pain in the knee, that both of his knees feel identical, because you notice once you get a tear in one of your knees, no matter if you have surgery or not, you feel the difference in the knees. One is stronger than the other. You notice it. So I opted for the PRP, and what they do is they draw your blood, and they use this machine that refines it down to take the material out that they need. So they drew my blood. I waited for about a half hour in the office, and then they brought me in. They set me down this table. I laid down, and it was a doc there and 2 assistants, and they had this ultrasound machine. I actually could see the meniscus tear through that. So they pinpoint exactly where they want to inject the material. injected my meniscus area first, and then whatever I had left over, I told him make sure you go to the kneecap because that's where I had the cartilage removed. I think that's where most of my pain is coming from. My orthopedic really said that my meniscus is not causing me any pain. It's most likely arthritis or cardiomyalgia. They're saying in the kneecap. I get the pain going up and down the stairs. So let me just tell you though, from my experience, I watch some other videos online, especially this one lady, and she's online, that they numb you up. I'm not afraid of needles or anything, but you know, it's still a nerves wrack when you're getting something done. But you know, once they start injecting that fluid, even though you're numb, you start feeling that fill up your knee, and it gets pretty painful. It's bearable, but it's painful. So once they did the meniscus area, they did the other kneecap, and I had to sit down for about 15 minutes, lay there and ice it for a little bit, and then moved over to the chair, waited there 5 minutes, and I was able to walk out of there. Now, as the time went on, I started getting stiffer. My knee now, which is 2 days later, is swelled up bad. There's really not much pain in there at all. The first night there was from the injection, but after that, now it's just swelled. I really can't bend it. So time will tell what happens. I'm really hoping that this helps me at least a little bit, you know, to avoid the surgery. So for anyone else out there that's looking to have the PRP, I recommend it. I can't tell you if it works or not now, but as time goes by, I will take more videos and clips of what's going on and keep you guys updated to let you know what my experience is with this PRP. Anyway, you know, for the cost for me here in Jersey, it was $450, and like I said, it's October 2018 now, so who knows? It's probably going to change if this really starts working. There's going to be a demand for it. So we'll see what happens. I'm looking to have this heal up, get back to my normal activities. Now, hopefully, this swelling goes down because you know I got a family fee. I got to get back to work soon too. So. But that's about it. If you guys have any more questions at all, just send me a message or write in the comments and I'll get back to you. But stay tuned. I will be making future videos on my experience with this and updates of how the knee's doing. And that's it. Thanks for tuning in. See you in the next one.